Hi, this is Health and Wellbeing with Marsh, and I am Marsh, and this is part two of diabetes type 2. So, in the previous video, we looked at the causes of diabetes, identified what it was, some of the symptoms, some of the indicators, and today I would like to talk to you about the risk factors of diabetes type 2. And then onto the complications of diabetes type 2 if not treated. And on a positive note at the end, we'll finish on preventions of diabetes type 2. Now, some of the factors that may increase your risk of type 2 diabetes. Being overweight is a main risk of developing the condition. However, you don't have to be overweight to contract the condition. It's a misperception that you must be overweight, but indeed not. Fat distribution. If you store fat mainly in the abdomen, you have a greater risk of type 2 diabetes. If you store it elsewhere in your hips or your thighs, on your waist, anywhere around that area, greater than say 35 inches waist, there's a good chance you will develop it. If it is that you're inactive, the less active that we are, the greater the risk of contracting the condition. Physical activity does help control the weight and uses up glucose, and energy makes yourself more sensitive to insulin. Family history. The risk of type 2 diabetes increases if your parent or sibling has had the condition. Your race. Although it's unclear why, but people of certain races contract it develop than other people. If you're Hispanic, Indian, Asian, you're more likely to develop the condition than white people. Not sure why, but it's a fact. Your age. Round about the age of 40 to 45 is when we start relaxing more, we start getting less active, get a bit more lazy if you wish. And the muscles lose mass and we gain weight as we do with age. But type 2 diabetes is also increasing, as we mentioned in the earlier video, amongst children. It's hand in hand with child obesity. We have something called pre-diabetes. That's a condition in which your blood sugar is higher than normal, but not yet classed at this time as being diabetes. Left untreated, it will progress to type 2 diabetes. Now, we continue with more complications, and there are so many that I had to pause for breath. But heart and blood vessels, the diseases in the heart and the blood, dramatically increases, and the risk of heart disease, stroke, the blood pressure and narrowing of blood vessels, all hand in hand. Nerve damage, neuropathy, excess sugar can cause tingling and numbness and burning of pain. Within the nerve ends, your fingers, your toes, they can sometimes lose feeling. Kidney damage. Diabetes can sometimes lead to kidney failure and a reversible kidney disease, which may require dialysis or a kidney transplant. Think of that. Dialysis. And something what springs to mind, and I've not got a note on it, is the effect of not just a dialysis machine and being on it, but that of the use of steroids. If you use steroids for a time lapse of greater than, 3 months or greater, there's a high risk of developing type 2 diabetes there. So that's, something that can be out of your hands. Eye damage. Diabetes can sometimes lead to the risk of serious eye damage, such as diseases such as cataracts, glaucoma, and the damaged blood vessels within the retina, potentially leading to blindness. Slow healing. We mentioned that quickly in the last video, but more detail, if left untreated, the cuts and blisters, they can become infected, and the serious infections which heal poorly. Yeah. Severe damage might require toe, foot, or even leg amputations. Hearing impairment. We get more hearing issues with diabetes, yeah? Our hearing starts to go. One favourite subject of mine, sleep and sleep apnea. There is nothing more important than getting it's like an old wives' tale, a good night's sleep. Sleep apnea is related in many occasions to obesity. I've had it myself. I've had it for 6 months. And that goes hand in hand, again, as a risk with type 2 diabetes. Sleep apnea, just think of it, losing your sleep, and then you don't get a good night's sleep. It can go on to your higher blood pressure, we get moody, blah, 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 all in hand with this. Alzheimer's disease is also a higher risk, yeah? And let's now look at the preventions. We've done enough of the potential risk and complications, but preventions, healthy lifestyle choice. I would suggest to anyone, we can all do it. I'm seriously thinking of doing it. We've all done enough diets in the past. 95% of people who diet put weight back on. I've done it a number of times. I've lost 13.5 stone once, 7.5 stones. I can lose it, but let's not choose it as a diet, but as a change of life for healthy lifestyle choices. By that, eating more healthy foods, getting some exercise every day, not being as inactive, and if it is that you've had diabetes within the family, you've already received a diagnosis of diabetes, you can usually choose healthy lifestyles to prevent this. Eating fruit, vegetables, yeah, and just generally looking after yourself. Choose foods that are lower in fat and calories, higher in fibre. And again, besides the fruit and veg, maybe concentrate on whole grains. Aim for 30 minutes exercise a day. An hour is tremendous. And no, we don't mean, say, necessarily pumping iron, but maybe a 30-minute, if you're having a brisk walk or, out for a swim, if you can read a bike. Not all, we're talking about this particular subject in lockdown, and I know it's hard. I live in an apartment block, there's no lift, so I'm starting to use the stairs, going up and down. It's very repetitive and boring. But whilst I'm not doing something else, then I might as well walking up and down the stairs. Again, I'm just looking at myself and doing an overall on me. Avoiding being sedentary for too long. Instead of being a couch potato, if you wish, standing up, get the circulation going, swing your arms around, If you carry on watching the telly, there's a number of things you can do. Just don't stay sat down. Sometimes medication is an option, yeah, to reduce the type 2 diabetes. But there's a number of factors it is that we can do ourselves. Some things, as I mentioned before, like we've taken steroids or we're on a dialysis, you are at the mercy of other issues, and people like that, I would suggest, as you're already probably doing, keep the chats going with the doctor, yeah, and one will say that if it is that you're going to start increasing or making your lifestyle better, make sure he's aware of it and what you're up to. I would like to thank you all, and if it is that you like the video, then please like and subscribe, and I will say a good afternoon from Berlin. Bye for now.